In the studio now for this week's health segment is Dr. Alan Schuldiner, professor of medicine at the University of Maryland School of Medicine and diabetes specialist at the University of Maryland Medical Center. Thank you so much for coming in tonight.
Pleasure to be here.
You and I were talking earlier about diabetes, and diabetes is increasing at such an alarming rate here in the United States. They said that if present trends continue, 1 in 3 Americans will develop diabetes in their lifetime. That just sounds like an awful lot of people.
It sure is, Yolanda, and very scary numbers at that. Right now, about 8.3% of the United States has diabetes. An equal number has diabetes and probably doesn't know it yet. And those numbers continue to increase. And not only in the United States, but many other countries around the world are already seeing epidemics, and increases will be even steeper in some of those countries, such as Southeast Asia, India, China.
And we're going to talk about maybe some of the contributing factors in a second, but I want to just highlight this new report that came out by the CDC, the morbidity and mortality report that looked from 1995 to 2010, where they said there was a 100% prevalence of diabetes cases in 18 states, 50% increase of diabetes in 42 states. And a lot of these states were actually down in the South, but nonetheless, 100%, 50%. These are shocking numbers, no?
They certainly are. The main increases in diabetes have been in the adult form of diabetes, so-called type 2 diabetes. And the prevalence rates of that kind of diabetes seems to parallel rates of overweight and obesity. This is one of the main reasons why we're seeing an epidemic today is that America is eating too much and they're exercising too little.
So obesity is the cause of the increase of diabetes in this country?
We think that that's one of the big factors in the increases, particularly for the adult form of diabetes, type 2 diabetes. There's another form of diabetes called type 1 diabetes that typically affects children. And that kind of diabetes is also increasing. The reasons behind that are a little bit less clear. But certainly it's the type 2 diabetes, the adult forms of diabetes, that are increasing. And also, in a very alarming way, the adult forms of diabetes are increasing at younger and younger ages.
Like what? Like what's a young age compared to before?
Well, right now, children are actually getting the adult form of diabetes. Children ages 8, 9, 10, with extreme overweight and obesity, they're getting the adult form of diabetes 30 or 40 years earlier than years past.
In addition to me asking questions here in the studio, we also have a video question from one of our viewers that we'll pose to you as well.
Strategies would they recommend to help parents convince their kids to be more careful about their disease and take better care of themselves?
So obviously he's talking about juvenile diabetes, which I said earlier, and you said that's kind of an old term, huh?
Well, we still use the term juvenile diabetes, but the more formal term is type 1 diabetes, and that's the kind of diabetes that most often afflicts children. And it's caused by the immune system actually attacking the pancreas, the beta cells in the pancreas, so that no more insulin can be made. And this is what requires children with type 1 diabetes to actually inject themselves with insulin. Oral medications can't be used for type 1 diabetes. And this is one of the reasons why it's so difficult to treat children with type 1 diabetes, because they have to be taking often multiple injections of insulin each day.
So what strategies can you do, like Mike asked, to help parents convince their kids to be more careful about their health and lifestyle and being responsible about this? Because that's kind of hard for a kid to do.
That's most certainly right. Children, and also when children with type 1 diabetes go through adolescence, it gets even worse. But I think the key really is that people with diabetes who manage their blood sugars, they feel better. Their energy levels are better. They're going to the bathroom less often. They're sleeping better. So I think children really can't be too concerned about those long-term complications, because those are things that they just don't think about. But the idea that they'll feel better if they treat their diabetes more aggressively, I think is the way to go.
Let's talk about the costs surrounding diabetes. In 2007, it was $175 billion. You and I were talking earlier, you said it's about $200 billion. And if you do the math exponentially, we're going to get to almost $500 billion in healthcare costs by 2020. That's a staggering amount of money that's going towards caring and treating diabetes. And this is a disease that's kind of preventable if you take care of yourself.
Well, it's preventable and certainly treatable. And much of the cost behind diabetes is not so much the cost of taking care of the diabetes, it's the cost of the complications of diabetes. Heart disease, kidney disease, eye disease and blindness. And those are the kinds of things that can be prevented by treating the blood sugars and keeping them as normal as possible. That, of course, would decrease a lot of morbidity, a lot of mortality, and major healthcare costs.
I know that you are looking into some studies to see what role genetics play in all of this. Are our genes, could they potentially be responsible for us getting diabetes?
Well, a large part of the story is genetics. The genes that we inherit make us susceptible or not to developing diabetes. And then, of course, there's the overlay of our environment, in particular an unhealthy environment, one in which we're eating too many calories, getting obese, and not exercising enough.
Let's see if we can go back to one of our viewers out in the field who has a question again for you, Dr. Alan Schuldner.
Is neuropathy a side effect of diabetes? And if so, how do you prevent it?
Neuropathy is one of the chronic complications of diabetes. It usually manifests as numbness or tingling in the toes and the fingertips. It can also be quite painful. And it's a consequence of high blood sugars that occur over many months and even years. And the way to prevent it is to manage the blood sugars, to keep the blood sugars as normal as possible. That doesn't necessarily guarantee that people with diabetes won't get neuropathy, but it decreases the risk of the development of neuropathy.
I was saying to you earlier, I have a lot of friends and family members who have diabetes, and their big thing is they really have to cut out the sweets. They have to cut out the sugars. But you were saying that that's not necessarily the case when you're dealing with diabetes. Clearly, you need to be aware of it, but that's not everything, right? What's the best way to treat it? Is it medicine, adopting a healthier lifestyle? What are the ways that you can beat diabetes?
Well, for type 2 diabetes, the main modalities are diet and exercise first, and then if the blood sugars are still not controllable with a healthy diet and exercise, then pills can be used for people with type 2 diabetes, and there are multiple different kinds of pills that work pretty well for people with type 1 diabetes or people in which the pills are not working for type 2 diabetes. Then insulin injections are the best treatments.
All right, we've got one more question from one of our people on the street, and let's take a look, see what they have to say.
Well, why should I be so worried about my feet when I have diabetes? Why do I have to go to a podiatrist every year and watch my toenails and everything? I've always wondered about that.
All right, that's from Steve.
Yes, well, the problem with feet and diabetes is that over time, people with diabetes don't sense their feet as well. They have numbness, often from the neuropathy that we talked about. And also, circulation often is not quite as good in the legs and the feet in people with diabetes. And that makes them prone to getting infections in their toes that then won't heal well despite even antibiotics. And so the key is to try to prevent those infections from happening. And that's why going to a podiatrist to prevent any of these problems from happening is an important way to take care of diabetes and to prevent those complications.
One last question about pre-diabetics. American Diabetes Association says 79 million people are pre-diabetic in this country. Does that mean that you will become diabetic?
So if you have pre-diabetes, it means that you have high blood sugar levels, but they're not quite high enough to make the diagnosis of diabetes. And in those individuals, yes, they're prone to developing diabetes in the future.
So what's the future for diabetes? We've talked about these staggering healthcare costs and things that you can do to prevent it. What do you think is going to happen in the next 5-10 years?
Well, I think for one thing, America needs to adopt a healthier lifestyle. We need to eat less in terms of calories. We need to continue to exercise more so that we keep our weight down. And that's really the main way to prevent or delay the onset of diabetes.
All right, well, good advice from Dr. Alan Schuldner from the University of Maryland Medical Center. Thank you so very much for coming in to talk about this important illness here. And we should also mention that November is National Diabetes Awareness Month, right?
Right, yes.
So we've got a few more weeks to celebrate. Thank you so much for coming on the show tonight. We appreciate that.